Here we are again, Tim.
I know it's been a bit, we've had a bit of a gap, haven't we? We've had a bit of a, I'm sure there's people out there who've just been absolutely just waiting for this next kind of podcast to drop, haven't they? I mean, I don't know what they've
Oh,
been
yeah.
doing with
Well,
their
forget
time.
traitors. They won't even be thinking about traitors. They'll be thinking about when's the next podcast from Tim and Ollie and Peak Health Coaching, you know.
Yeah, maybe, maybe not, maybe not. Uh, yeah,
Maybe
traitors
we
is
maybe we should have
a
some
good.
evictions on the podcast. Maybe we should sort of have some murders. You know, that would,
Okay. Yeah, that won't take long. That won't take long.
yeah. Who's the traitor out of you and me?
So I mean, the reason we've not, I suppose, is because we really be busy, kind of doing all sorts. We've been out and about. We've been to lots of different kind of conferences and things, and listening in to kind of what's going on. I know you've been to the Health Creation Alliance conference. Is
Yeah.
that right?
I have, and it was really good. We try and do this, don't we? Pick out the things that have captured our interest. I went to a fantastic conference. Health Creation Alliance have been around for a while. Merrin, who leads it, brilliant, and it draws together really interesting people that they're in that space of creating health, you know. And they talked about health creation and wealth creation to the sort of economic value of health. But what really stuck out to me, it was lovely to see Minal Bakai, another GP, fellow GP. She's the director for primary care. Let me have a look. Direct for primary care transformation and the neighbourhood implementation for NHS England. She's got a big job card, and she's a dynamite. I mean, she's got so much energy and vision, so sharp and clever. And she was putting up the outcomes for these new neighbourhood teams that are evolving, and it's just so heartening to see six core outcomes. One of them is around staff experience, you know, and that's always been close to my heart. Well, a couple
Mm.
around patient proms and prems, a couple around flow through the system, you know, sort of A&E attendance and outpatient attendance, and then one around activation, people activation, which made me think, Tim, we've got to talk about it.
Yeah, of course, because we talk a lot about patient activation, don't we, on our courses? And I know, I mean, maybe some people are less familiar with it. I mean, is probably worth just talking a little bit about the concept of patient activation. I know they're
Yeah.
calling people activation, which is slightly different. It'll be interesting to think how they're going to measure that. But I imagine because they're talking about those same domains of confidence, knowledge, and skills, so maybe it would be worth just taking people back if they're not familiar. Is that shall I
Yeah,
do that?
good idea, because it's sort of been in our DNA since we started, didn't we? We've always seen the value of this concept of patient, or call it people activation, maybe that's slightly wider. Yeah, so why don't you recap what it is, Tim?
Yeah, so this is a validated tool, the patient activation measure or the PAM. And what it measures is people's confidence, knowledge, and skills to manage their own health and healthcare. So again, if you've not come across the term activation, and it sounds a bit strange because it's come from the States, that's maybe why
Yeah.
Insignia Health introduced it to the NHS a number of years ago now. I'm going to struggle to remember exactly how many years, but it
I think
was
it's been 30
licensed.
years, you know. I think oh God, what's the name of the lady who d developed it? Oh, it's gone from my head now. Um,
Hibbard.
But yes, Judith Hibbard. Thank you very much. Yeah. So she was a researcher, psychologist, wasn't she? In America and a university, and she took it from research 30 years ago. That started, and then it came into the sort of like as a useful tool, didn't it? It got marketed as a tool.
Yeah, and NHS England purchased some licenses, didn't they? And
Yeah.
that wasn't so long ago, but it was for 5 years that they had these licenses. And I know we were on the trail, kind of training people how to use this validated tool really well. That was one of the courses we were running at the time, because lots of these licenses were dished out, but people didn't really know how to make use of the tool. And again, of course, a tool's only as good as how it's implemented, how it's used. Otherwise, the results you get back, of course, are not that useful. So we did spend a bit of time teaching people how to use that really well. And then, of course, as personalization and personalized care started to come back more into the fore, sadly, I think just as that was taking off, the license ended. So
Mm.
again, people were like, "Oh, now I've got an opportunity to kind of measure this thing that we're doing now in terms of personalized care." But actually, we've got this tool, we now have to pay for it. So it kind of fell out of favor a little bit. So again, if you've not come across it, it's because it's not so widely available. I think there are still some places using it, but it's not as widely used. But the concept, you're absolutely right. The concept is the thing that we absolutely thought was so useful, even if people aren't using the measure.
Yeah.
But I'll take people back. So the patient activation measure is a validated questionnaire. and it has 10 questions or 13 questions. And at the end of that questionnaire, you have to input the data into some software and it spits out some metrics. And the metrics are someone's activation. Out of 100, what their percentage of activation is. And each of those then corresponds to a level from level one, where someone is really low in their confidence, knowledge, and skills, all the way up through level two, level three, and level four, where someone is really high in their confidence, knowledge, and skills to manage their own health and healthcare.
Yeah, yeah.
And the idea being that if you knew what someone's starting point was, how confident, how knowledgeable, how skillful they were when you started working with them, then you could tailor your approach to that person. And I think that's the thing that we've been most interested in at Peak Health. What we don't want is people leaving our courses and coaching everyone, whether they like it or not, to kind of set goals and all that kind of stuff, when actually they're not ready for it.
Yes,
So
absolutely.
does that make
Yeah, no,
sense?
absolutely. And I think what we got our heads around, wasn't it, is once you've got a measure, it's a bit like before we could measure someone's blood pressure, we didn't quite know what it was and we didn't know whether there was a value in influencing it, what happens if you make it lower. So there's something about developing a measure, isn't it, that shines a light on a concept, isn't it?
Yeah.
So Judith Hibbard knew that this was an important concept, people's skills, knowledge, and confidence to look after themselves, a really key factor in health outcomes for people. But we couldn't measure it. So we had the validated measure, I think, for us prompted the concept. And then this sort of what emerged out of it was that you can kind of categorize people in these four broad categories, and that's really useful, isn't it? Because we've seen from evidence and experience that actually if you can build people's activation, so take them from level one up to two to three to four, actually health outcomes and all the things we want follow on. So it improves experience of care, it improves the utilization. You use services much better, sometimes more, sometimes less, but when you use it more, you use it well, so you get better health outcomes. And the staff satisfaction is higher as well when people are able to move from low activation to high activation. So as a principle, it's been something we've been really wedded to, isn't it?
Yeah, agree. And it might be helpful just to characterize those people at those different levels, just so people can kind of start to picture
Yeah,
people at those levels.
go
So
for it.
again, people at level one are overwhelmed and disengaged with their health, and often for really, really good reasons. So sometimes we think, oh, people are, they're not compliant or they're not bothered about their health, but often it's because they're working two jobs, they're looking after young kids or elderly parents, and health is way down the list in terms of priorities.
Yeah,
So that's people at level one. Level two, people realize they've got a contribution to make to their own health, but they don't know where to start.
yeah,
So in some ways, people at level two are slightly more vulnerable than people at level one, because at level one, they think it's someone else's job to sort out.
yeah, yeah,
But at level two, they think, oh my goodness, I thought it was someone else's, but actually, no, I've got a role to play. So that can be more anxiety provoking. People at level three are starting to take some action. They're starting to do some things. So they're probably starting to self-monitor their conditions. They're maybe taking their medication properly. They're starting to engage in maybe some exercise and some healthy eating. They're starting to do some stuff, but maybe they're not that consistent with it. And then people at level four are essentially your self-managers. So they're doing stuff. And probably, if we can pick the right ones, they're a really good resource for the people who are less activated, because it can maybe help them bring them along on that journey because they're in a similar situation to them. Does
yeah,
that?
absolutely. And obviously having a formal validated measure like the patient activation measure enables you to sort of formally evaluate it, doesn't it? It's 13. I think the 10 question one is the one I really like because it's almost as good as the 13, like 98% as consistent, but it's three questions less. The less questions you can ask, the better.
Yeah.
And we'll come on to even there's a single question one, isn't there, that our friend Jag Munder has developed. We'll come on to measurement in a minute. But what actually it's led to my most favorite question in primary care, which you knew I was going to want to talk about. And if you haven't got a formal measure, I find asking something like, "Tell me what you're doing to look after yourself at the moment." It's a great starting point for a health coach anyway, but it's very revealing about their activation because given what you've said there, if someone's response to that is, well, that's your job, isn't it? I just take the tablets, doc, and you do the thinking for me, or I listen to her indoors. You kind of know they're at that level one. That's a very quite passive. It's not really about me. It's about you. If they say, "Oh, I know I ought to do something to look after myself. I really ought to," and they almost feel guilty and overwhelmed. But life's crazy at the moment. The kids are going nuts. My looking after my elderly parents. The work's crazy. My boss is on my back all the time. you kind of know they're at that level two where they kind of know there's something they ought to do, but they feel a bit guilty, struggle to find time and space. That level three you talked about, I think the response to that sort of, what you're doing to look after yourself might be, well, actually, yeah, here, let me tell you some of the things. Here's some of the things I am doing. Some things they're carrying on with. Some things have fallen by the wayside. They've got some ideas. It's that forward and back, probably like most of us. And then the level fours, often you don't even need to ask that question because you kind of like, they've already shown you their kind of printout of their blood pressure self-monitoring or their sugar scores they've taken from their freestyle Libra or something. And you almost see those level four people as an asset to the system, don't you? So I
Yeah.
think there's once you've tuned into the concept, it starts to open up a really interesting way of practicing, but also, as Manel's leading to, monitoring progress of a system.
Exactly, because we tune into that, then we can realize that actually we're not going to do the same for everyone. If you've got someone who's level one, you're going to do have quite a different intervention than someone who's at a level four and is a self-manager. But I think what we're quite good at doing in the NHS is kind of doing this kind of one size fits all a little bit. I know we're getting a bit better in terms of personalization, but
Yeah.
we give everyone the same length of time. If you've got type 2 diabetes, you go on a Desmond course. And nothing against Desmond course, by the way. It's just that for some people, they're not ready for it. And for some people, they don't need it because actually they'll have a website and they'll go and sort stuff out themselves. But we do like to have this kind of system. And I know it makes sense, but maybe we can get a little bit more intelligent in terms of the intervention we use because resources are really precious. So let's make sure we're using them in the right way with the right people.
Yeah, absolutely. And I think that's why I can tell you're excited by this, Tim. And I think that is what's really excited us about activation in the past. And now brilliant to see this coming into the neighborhood teams because not only is it a good way of tracking progress, if you hold yourself accountable to building people's activation, growing their skills, knowledge, and confidence, we know that's a good thing. It builds resilient, capable people and communities. So not only is it good to track as an outcome measure, actually, it's really great for tailoring and making sure that you're doing that sort of get it right first time. You're tailoring right intervention at the right pace to the right person at the right time. So it saves energy and time. It builds really good therapeutic relationships, and you can also track progress over time. So it's a really smart move, I think.
Yeah. And I suppose the other thing that it's useful for is picking up those really early changes, which where you don't necessarily see kind of the normal kind of measurable outcomes that we do, which is kind of maybe weight loss and blood sugar reduction and blood pressure reduction, all those kind of things which are easy to measure and therefore we measure them. The
Yeah,
kind of what we kind of teach is really the activation piece is the bit that sits below the surface.
yeah,
And therefore much more difficult in some ways, potentially much more difficult to measure it or to see changes.
yeah, yeah,
But the patient activation measure absolutely picks up those early changes. And I think what we know from the data is that the steepest bit of the curve in terms of outcomes is the movement from level one, which is where people think their health and well-being has nothing to do with them, to level two, where they realize they've got a contribution to make. And I think the most interesting thing about that is nothing has physically changed in that. They haven't stopped smoking yet. They haven't lost lots of weight. Their blood sugar is probably the same. Their blood pressure is the same, but they've got a change in mindset.
yeah.
And
That's
how do
really
you
interesting,
pick
isn't
that
it?
up?
Yeah, it's like that early marker, isn't it? And we know, don't we? So often, GPs, quaff targets, practice nurses, physios, OT, everybody's concerned with, as you say, changing those measurable metrics of weight or blood pressure or sugar. But actually, ahead of that there comes the someone has to engage and feel they've got a role, then they have to start making some changes. And it's only then that they materialize some of those sort of more sort of medical outcomes that we hold ourselves accountable to. But as you say, those early changes are where you see the steepest gradient of transition. So
Mm,
actually, you know, if you've got someone like a health coach or a social prescribing link worker, and all they're doing is engaging people that wouldn't have normally engaged and helping people to start to feel a sense of self-belief and confidence, those early stages before they change a great deal about maybe some very early actions maybe, but before it's manifesting as changes in medical outcomes, you've got that really important early change, and that it is so important to see that, isn't it?
yeah. Yeah, it's reminding me of a supervision session I had with a health and wellbeing coach, and they were telling me about someone they were working with, and they were really disappointed because they worked for them for 3 months, but their blood sugar really hadn't changed at all. And they've done they put lots of things in place that they started to think about their diet and their nutrition, and they were starting to start to do some regular exercise. So they were doing loads of lifestyle stuff, and hadn't made a difference to their blood sugar and their cholesterol, hadn't made a change, and they were so disappointed, and the patient was really disappointed. But I was thinking, yeah, but look what's happened.
Yeah,
The person has utterly started to think about their own health.
yeah,
That's
yeah,
kind of, you've done your job, in some ways, because they're starting to think about it, and that will going to continue to benefit them because they've had a change in their mindset. That's the thing,
yeah, yeah.
because
It's
that's
that
the thing that informs
that
the behavior.
Yeah, it's that flywheel analogy, isn't it? I think it was Jim Collins, wasn't he, who wrote about that way back, like sort of getting that flywheel going, the inertia of getting people to engage and getting people to start to think positively is what gets that kind of like flywheel going. And then as you start to build momentum, it has a momentum of its own, and then people carry on doing things that are going to benefit them long run. It's a great thing to pursue. Yeah, great. So I guess the trouble is, I mean, it's a challenge, isn't it, for the neighborhood teams? I guess I don't know if Manal and team have necessarily cracked this. Is how you measure it, and of course, the danger with measuring anything is measuring it in a way that doesn't then have an adverse effect on the system, isn't it? So often when we try and measure something, it has a negative effect because people try and game it or they try and just chase a number rather than the spirit of how do we actually you know allow ourselves to be free to build this activation, build people's self-belief, their confidence. They're such delicate things that could easily be smashed by having to hit a target, right?
Yeah, indeed. And I know, and then you mentioned Jag Mundra, who came to kind of talk at our conference earlier this year.
Yeah, we do like Jag, don't we? Such a great.
Yeah, and he's just got so much energy for kind of measurement and just making sure that what we're doing is adding real value. And it's so key having people like that who are really happy to look at the numbers and crunch the numbers and kind of and make sure that we're on track and doing the right kind of things. Because again, and we're very much like minded like that. You know, it's great, isn't it, to provide great training, but it only matters if it impacts on the ground. If that changes someone's the way that they work and that has a positive impact on the patients and they get to kind of feel empowered to look after their own health, that's great. All right. In fact, there's no other point. There's no point to doing what we're doing if that's
No,
not the end
absolutely.
result.
Absolutely. Jag is what really impresses me about Jag. He's so pragmatic, isn't he? He always talks, isn't he, about things being doable and manageable. So I know he spent a lot of time working with the National Association of Primary Care, and I think he's also helping out now with the National Association of Social Prescribing and with Manal's team. I'm pretty sure around how do we crack this measurement, make it simple and easy. He talks about quick and dirty sometimes that it's easy to do. We know that with the patient activation measure, even with the 10 questions, it was quite tricky sometimes to get that into the consultation, to get that reproducibly done all the time. So he's worked on a single question activation measure, isn't he? Um, I know it's not validated in the same way as the PAM is, so you could argue it's not as academically robust. But he's now got a large data set of people and can see correlations, can't he, between the single change in that response to a single question around activation and outcomes and things in the system that are really useful. I know
Yeah.
have you used this single question?
Well, no, I talk about it a lot. I mean, I appreciate it's not validated, but I suppose because it's a single question, it's so straightforward, and you can see how you could easily use it really early on in a consultation, or really early on in a period of time you're working with someone, and then you could just check it again at the end and just see what the change is. So his question, I think if I got this right, is I'm going to look at it here, but it's how good are you at taking care of your health? And it kind of rates it
But
from
just
one
say
to
that again,
three,
Tim.
four.
It's so
So how
simple,
good
isn't it?
are you? It's very similar to your question, Ollie. So how good are you at taking care of your health? So
Yeah,
one is not very, two is okay, three is good, and four is excellent. Okay,
right.
just simple rating scale.
So
Okay.
you're getting people to self-rate how they
Yeah.
perceive. So there's something in there, isn't there? I remember when we were teaching about using the patient activation measure. When you ask that question, you need to make sure people feel comfortable to answer honestly and without pressure, don't you?
Exactly. So kind of again, exactly the same way in the patient activation measure, you've got to make sure that people feel safe, they feel relaxed, that they don't feel under pressure, all of those things. So yes, you need to think about when you ask that question. It will not be the first question that you ask people, but you will lead people into it and reassure them that it's just for us to kind of work out how we're going to work with you and
Yeah.
what's the best things that might be useful. So again, when we talk about it on when we were training people in the patient activation measure, we got people to practice it. How do you introduce this question and ask these questions? I mean, when we're people talking about 10 questions, which is a lot more challenging, but
I
it's
think the
not
principle,
validated yet. It's not validated yet.
no.
But
But the
what is
principle is the same, though, isn't it? I think about that, introducing it well, and I think that's the dilemma we have, isn't it, with any measurement? If you're being paid according to it improving, let's say, there's always a sort of a little bit of a pressure on the system, the clinician, the even the patient to sort of like, to overscore, to overplease. And I think one of the things that I learned from the scoring of the more formal PAM, which I think comes into the kind of single question, is that higher score is not always better.
Mhm.
The what really matters is honesty and then being able to tailor your system. And obviously you want people to improve their activation because their outcomes are generally better. But we noticed, didn't we? One of the things that was really struck me is that very often when you ask people to self-score their activation, initially they might be tempted to go really high. So they might say, excellent, I'm excellent looking after myself, or I score really high on the PAM score. And then as you start to work with them and they realize what that really means and they actually become a bit more honest and real about what's going on, sometimes their score drops. And that's actually a positive thing, isn't it?
Yeah, exactly. And there's a story there, isn't there? There's part of that is kind of feeling like, oh, and sometimes for people, it's like, well, I thought I was quite good at managing my diabetes, but actually, and now I realize there's a whole load of stuff I didn't know. And so maybe there's more to learn. So there's a bit of that as well, I think.
Yeah,
But I think,
it reminds me of a story when I was learned to when I was horse riding and I'd been out in New Zealand and in New Zealand they just shove you on horses that can gallop across the galloping fields and so I got used to that and thought I was a real dab hand at riding a horse. Do you know what I mean? And then we were on holiday and the lady who was running it said, "Right, who here is is a expert at riding horses?" And I put my hand up and went, "Yeah, yeah, that's me. I'm a galloper. That's me." So she said. Okay, there's the saddle. Go on then, go and put it on the horse. And I went, oh, I don't know how to put the saddle on. And she went, oh, right, so you're a beginner then. So you can sometimes we do overscore ourselves, don't we? So for me, there's something about a measure being able to be used in a way that's most useful and most honest and productive. And that's going to be the secret sauce in these new neighborhoods, isn't it? Is using the concept of activation really intelligently and really well.
yeah. And also kind of measuring over time as well, because again, when someone has been going along at maybe kind of a kind of a level 3 or a 4, and then they come and the next time you see them they're a level 2 or a 1, there's
Yeah.
a story. And that's the useful thing about that. It just prompts a conversation to kind of just investigate a little bit more. And I suppose maybe people have got there, but it just takes you there really, really quickly.
It
Uh,
does. It does, and sometimes when people listen to our podcast, they flick off early, don't they? So right now, towards the end, I'm going to bring in some what I think is gold dust from my experience of a as a primary care CD, and what I've noticed in our network, working with patient champions, working building peer support, seeing the value of really growing an integrated neighborhood team, is that you can think of activation on a personal level. So you might think about patient activation and want to measure that. But I think you can also think about activation on a sort of on a group level, on a sort of peer-to-peer level. And then maybe sort of even above that on a sort of system level in terms of co-production and how willing patients are to join in designing the system. And equally how activated clinicians are to the idea that it's important that patients are involved and building their participation and building their skills, knowledge, and confidence. So I think I'm wondering as integrated neighborhood teams develop, whether they'll be sophisticated enough to include all those aspects of activation, an individual level, a sort of group level, but then a system level as well. And I'd love to see that developing and think about how that might be measured and captured. I don't know. What are your thoughts about that, Tim?
Yeah, well, I think that's really interesting, and it takes it to a kind of another level. Say a little bit more for me then about the kind of the peer-to-peer part, and also the staff activation or the practitioner activation, because I think that's really key as well, isn't it?
Yeah, it is. And I mean, I think maybe that staff or clinician activation could cover all of those levels because you probably only value a patient activation if you really think it's worth it. So there's
Mm.
something there about clinicians thinking that it is worth, growing people's skills, knowledge, and confidence rather than just telling them what to do and you being the expert and you being the director. So there's something there about shifting your clinical mindset. Um, but yeah, I mean, it's certainly in our PCM, we've certainly not got it cracked. It's an ongoing thing, but we've seen so much positive um, energy, but also outcomes by encouraging patients to support each other, to do that peer support bit. We've even trained patients to be activated peer supporters. We've got a little bit of an induction program for them, and it's really bearing fruit. Now there's sort of four. There was five. It's about to become six again. Patients who lead our diabetes education for other patients. They literally do the patient education bit, and it's so much more powerful coming from them than it is from a doctor or a nurse. We'll often support them in the background, but actually, the storytelling and the reality check that comes from someone who lives with a condition is so strong. And for me, that's like peer activation. That's that
Mm.
bit. But then co-production, just for taking another example, we're doing this in chronic pain, but that example I mentioned around diabetes, the system we've developed for having patients leading the training, but also they do a roadshow thing now, which is where we will invite anyone on our diabetes list just to come to the practice at a lunchtime. We rotate it around the different practices in our network, and it's just a sort of background chat about what it's like to live with type 2 diabetes, a little bit of optimism, a bit of hope from people who have learned to self-manage well. And that sort of storytelling is really powerful. We call it the roadshow, and I wouldn't have thought of that. That came out of the patients, it came out of their ideas, and we've evolved it. The first time we did it didn't quite work, and so we've evolved the system. So that co-production is so valuable. But
Yeah.
again, you can think about the activation in terms of co-production and patient involvement at that level as well, I think. So I don't know, it's a sort of emerging field, isn't it? But I'd love to see integrated neighborhood teams with that level of sophistication around this concept of people activation.
Yeah. I suppose the other thing I really love about activation is the fact that it pays attention to confidence and skills.
Yeah.
I think in the NHS, what we've overdone is knowledge. Do you know what I mean? We've kind of got, oh, yeah, it's all about knowledge. If we download our knowledge, if we kind of tell people, what they need to know about their diabetes, or what we think they need to know about their diabetes, it's almost like job done. I've downloaded everything I know about diabetes. Now off you go. And then
Yeah.
we get surprised when people don't suddenly self-manage. And it's because we've not paid any attention to the confidence and skills, which I've heard from your story there. That is what's being built up by the peer kind of the peer support and the peer mentoring. That's the stuff. It's building people's confidence because people can see, oh, they're a bit like me. If they can do it, then maybe I can do it.
Yeah.
That's the things, and they've got they're learning some tools and some skills. Well, I can steal that one, or I can use that one. That's the thing, along with some knowledge. Don't get me wrong. I think we need that, but it's the whole package, isn't it?
Yeah, no, you're right. I think that's really, really savvy because we've done really heavy on knowledge, I mean, on knowledge giving. And I think what we've realized through our health coaching, and it's really clear in the evidence base, the power, I think, of the evidence base of the activation tool is that it's shown us that you have to think about skills and you have to think about confidence as well. Sort of it overlaps, doesn't it, with Susan Michi's model of COM-B with behavior change, doesn't it? Is that, capability, opportunity, and motivation. They're playing into much wider things. Yeah, knowledge maybe comes into your capability, but then also skills and confidence comes into it, and then your opportunity to join in and what motivates you to join in. These are all really crucial parts of how we do, get people to look after themselves better.
Yeah. And that's just reminding me, Ollie, because people may have heard me say this before, but people sometimes get confused, don't they, between activation and motivation.
Yeah,
So
go on. There is a difference, isn't there?
yeah, so activation is people's knowledge, confidence, and skills. We've heard that. And motivation is someone's kind of intrinsic or extrinsic kind of desire to do something different.
Yes.
But let me give you an example. Okay, I am activated when it comes to stacking the dishwasher. Okay, I am confident I can do it. Okay,
Yeah.
I am skillful and
Good
I'm
on you.
not.
I'm not activated with that at all.
Well,
It's
I
beyond
knew
me.
that. I
Yeah.
knew that about you. Okay, so I'm confident, knowledgeable, and skillful enough to do the dishwasher, but I'm not motivated.
Ah,
So you can see, so you can be, they can be kind of highly activated, but still not motivated. I know they kind of speak to each other a little bit, but they are different things.
yeah, no, you're right. And I think that's again, again the sophistication of a system, isn't it? Which we're trying to build activation as an ingredient here, isn't it? And I'm really chuffed that Manal and team are focusing in on that because I think it's such an enabler. But we can even take it wider, can't we? Think about whether motivation and opportunity, all those things come into it as well, don't they?
Yeah. So it is exciting. I know we've kind of been waiting for the kind of the neighborhoods, to start to take off, but it is exciting that it feels like they're looking at the right type of measures,
Yeah.
rather than some of the other things. I know there are some other the traditional things like the use of hospitals and unplanned admissions and things, which are kind of you would expect. But it's
Yeah,
also
it's fair
good.
enough, isn't it? We
Yeah,
want to
yeah,
be, I mean,
it's,
we've got to be all held accountable to doing stuff that's valuable to the system. But
of
I
course.
mean, the other one I love is this is the staff experience. Maybe that's a whole new podcast, Tim, thinking about that because certainly in our neighbourhood we've got a temperature check we do every couple of weeks around. We ask the staff how out of 10, how meaningful and how manageable has your work been across the last couple of weeks, and we pay real close attention to that because it's such an important marker of outcomes actually in the NHS. We know that from Michael West's work. So maybe that's another podcast, Tim.
I think that might be one for next time. Yeah, yeah, good. But it's been really good to speak to you, and I'm very excited about that patient activation, the person activation concept being used.
I know, I can
I can see
see.
there's
I can
absolute
see.
value in it as well. Yeah,
You never know. It might even get you stuck in the dishwasher.
you never know. You never know. I need the motivation to do that, Ollie.
Oh, yes, it's the motivation for that.
Yes,
Yeah, yeah.
thank you.
We'll have to work on that as well. Mate, it's always nice to chat to you.
Yeah,
And
and you.
congratulations if you've got to the end of the podcast. Please do. It's always interesting to hear your views. We'll put this out on LinkedIn and YouTube, and we are aspiring to get this onto a proper podcast, aren't we, Tim? We will get there.
We'll
Um,
get there.
and yeah, but your interplay with this and your reflections and views adds richness to the conversation.
Yeah, great. Thank you.
Nice one. Cheers.
This year.